A new study is questioning the efficacy of the Johnson & Johnson vaccine against the highly contagious Delta variant. NYU's Grossman School of Medicine conducted a lab test on the one-dose vaccine. The findings suggest more than 13 million people who received J&J's vaccine could need a booster shot in order to prevent future variant infections. Johnson & Johnson responded to the results, saying company data shows their single-dose vaccine has a, quote, strong, persistent response against the Delta variant. The study comes during a spike in newly confirmed cases of coronavirus. The CDC says the Delta variant now accounts for 83% of infections nationwide. And as the COVID-19 death toll climbs among the unvaccinated, there are new calls to action to prevent further spreading. CBS News' Skyler Henry has more.
The CDC says Americans are living shorter lives now, due largely to the coronavirus. The agency released new data showing American life expectancy fell 1.5 years in 2020 to an average age of 77.3 years. That's the largest drop since World War II. And now health experts say COVID deaths are on the rise again.
Over the last week, we have averaged 239 deaths per day, an increase of nearly 48% over the prior week.
The number of new COVID cases has tripled in the last month to more than 35,000 cases a day. The CDC says the Delta variant accounts for around 83% of new infections.
All of the current vaccines work against the Delta variant and every variant out there.
President Biden has made distributing the vaccine his #1 priority during his first 6 months in office. But some say that's part of the reason why some Americans are refusing to get the shot.
There is a lack of trust in government. When you see President Biden being so partisan on so many issues, frankly, misleading people on some things for partisan purposes, but then he says, go get vaccinated. Well, you can't separate that out.
Congressman Steve Scalise, the second-ranking House Republican in Congress, says he got vaccinated this week as Republican lawmakers are stepping up their calls for vaccinations.
These shots need to get in everybody's arm as rapidly as possible.
The latest CBS News poll shows Republicans are far more likely than Democrats to say they will not get vaccinated. Skyler Henry, CBS News, the White House.
Dr. Amesh Adalja joins us now for more on this. He is an infectious disease expert and a senior scholar at Johns Hopkins University's Bloomberg School of Public Health. Dr. Adalja, thank you for joining us. So, if you're one of the nearly 13 million Americans who received the Johnson & Johnson vaccine, should you be concerned about becoming infected with COVID-19 now that the Delta variety is on the rise?
We still need a lot more data to be able to know exactly how the J&J vaccine is going to fare against the Delta variant. We've got some conflicting studies, one that was produced by J&J themselves showing pretty robust protection, and now a new study that was posted on a preprint server showing that there may be some issues with the single-dose vaccine. But what I think is really important is to have real-world data, to look at the people that have gotten the Johnson & Johnson vaccine and ask the question, are they getting breakthrough infections more frequently? Are those breakthrough infections more severe? And I don't think that we have that type of data. It seems to be, especially when it comes to severe disease, which is the whole reason why we have a vaccination program, the J&J vaccine seems to be holding up. Whether or not we need to augment that protection, I think we need a lot more questions to be answered before we can pull the trigger.
So you're saying the fact that this study was conducted in a lab versus on vaccine recipients sort of in a real world setting, that might impact the accuracy?
Not the accuracy, but the applicability, because you've got to extrapolate something that's happening in a lab and ask the question, is this clinically relevant? Does it integrate with what we're seeing in the field? Meaning, are people who got the J&J vaccine, are you seeing them in the hospital now with breakthrough infections? And the answer is really no, because when you go through a hospital, and I was just working in a hospital yesterday and I'll be at one tonight, there really have not been that many breakthrough infections that are landing people in the hospital. So it's the unvaccinated that are getting hospitalized. And that's what I think is going to make these decisions much easier when it comes to deciding about boosters or if you need to augment the immunizations, is are people who are fully vaccinated, are they getting serious illness with a breakthrough infection with Delta or whatever variant? And the answer seems to be no. So I think that we still have to wait to know what to do with all of this data.
So you're saying that Americans who did receive the J&J vaccine and are a little worried and perhaps are considering getting a second shot, that they should hold off and wait. That's what you're advising.
Yeah, I would hold off. I would wait and see what more data shows, wait for official recommendations to be able to make that decision.
All right. And, we are seeing a growing number of fully vaccinated Americans who are testing positive for COVID-19. Is there a study around which vaccination most of them received? Is there any of that sort of information that's coming in yet?
To my knowledge, there's no signal showing any one vaccine is more likely to result in a breakthrough infection. And you have to remember that many of these breakthrough infections are, as you said, positive test results, because a lot of organizations are still testing people that are fully vaccinated, even though the CDC says if someone doesn't have symptoms and they're fully vaccinated, they shouldn't be tested. So I think that we've got a lot of interest in breakthrough infections, and it's not surprising. Vaccines aren't 100%, but the breakthrough infections that we're seeing seem to be very clinically mild, if even clinically noticeable at all. So I think we have to really think about what we want to do, what our strategy is with breakthrough infections. And I agree with the CDC that the breakthrough infections, the rare ones that land people in the hospital, those are the ones that we need to be focused on. Those are the ones we should study, not these asymptomatic cases that are being picked up because people are kind of doing blanket testing of vaccinated individuals.
And to be clear, it is not recommended that someone who's had a shot of the Johnson & Johnson go ahead and get a second shot of one of the other vaccines on their own, correct? That's not recommended.
It's not recommended if you've gotten the Johnson & Johnson vaccine that you need any additional doses. You're considered fully vaccinated if you've gotten your single dose of the J&J vaccine.
But would it be considered dangerous if someone did that?
There's probably not a major safety risk about doing it. It's just that there's not evidence to guide that decision. We know that there are mix and match studies going on to try and improve our vaccines, mixing mRNA vaccines with the AstraZeneca or the J&J vaccine. That's something that's ongoing, and the safety data looks good. So I don't think there's any danger in doing that. It's just that there's not necessarily a clinical need for it yet because we don't have the data to show that the J&J vaccine is failing in clinical real-world situations.
And, Doctor, last week the Yankees postponed their game against the Red Sox after 6 members of the team tested positive, despite 85% of the team being vaccinated. Additionally, we are seeing a growing number of U.S. Olympic athletes removed from the Tokyo Games after testing positive. Are these sorts of breakthrough cases to be expected going forward? And should fully vaccinated Americans be concerned about catching COVID-19 as the Delta variant continues to spread?
We're going to find more breakthrough cases as testing continues of fully vaccinated individuals. And it's often organizations like sports leagues, the International Olympic Committee, that are doing this testing of fully vaccinated individuals, and they're picking up some of these asymptomatic or mild cases, which really, from a clinical perspective or from a physician's perspective, aren't really serious infections. So that's the good thing. The vaccines, even when you get a breakthrough infection, are really having a huge impact on attenuating that disease, making it very, very mild. I don't think if you're a fully vaccinated individual, even in the face of the Delta variant, that you really need to worry about having severe disease, being hospitalized, or dying from COVID. That's just not happening. The vaccines are holding up really well, but we've got to get to a point where testing is more symptom-based and not just blanket testing of everybody, even if they're vaccinated, because we're going to pick up a lot of these asymptomatic breakthrough infections, and it's going to create headlines, and people are going to be worried. But really, the vaccines are working tremendously.
But, Doctor, the worry is if you are a vaccinated American who catches COVID-19 and, like you said, has maybe an asymptomatic response or very little response, you might not even know you have it. Then are you able to transmit it to an unvaccinated person easily?
The studies that are coming out on these breakthrough infections that occur with mild symptoms show that the amount of virus that is there is not likely to be contagious. You have lower amounts of virus, and you shed that virus for a shorter duration of time. So we don't anticipate those asymptomatic breakthroughs to be able to spread this. If I were investigating an outbreak, it wouldn't be the vaccinated people that I would be looking at as who were spreading the outbreak, the strain.
That's good news for a lot of families who have, of course, children who are too young to be vaccinated. You know, the adults may be vaccinated, but their children are not, and they might worry about that. So that is good news there. Well, Dr. Amesh Adalja, thank you so much for joining us. We appreciate it.
Thanks for having me.